Alicia from Livit Fitness.
Yeah.
That's correct.
Yeah.
Now, Alicia is one of my absolute favourite people to refer to on the Sunshine Coast. She's so incredibly experienced and passionate about what she does. So, Alicia's a personal trainer and a fitness professional, and you take seriously, you do one-on-one sessions, but you also do group-based classes as well.
Classes and one-on-ones.
Amazing. And you do that because I've seen lots of the stuff that you do is out in parks and out, in the sessions that you do.
Yeah.
Do you have sort of a studio or a gym where you've got gear that you take to that?
So I've got gear that I take. So I'm mobile.
Amazing.
So the outdoor sessions, either at netball courts or a park, and then I also just go one-on-one to people's houses. Also some small group sessions as well.
Which I think can be really, really
great
for mums as well.
Yeah.
But having that ability to be able to work and do a session at home,
yeah,
be able to work out from home. That's fantastic. So how do clients get in touch with you, or how do they find you?
Yeah, so I'm on Instagram at Livit Health and Fitness.
Amazing.
Or Facebook at Livit Health and Fitness as well. Yeah.
And so if a patient went there or a client went there, they could just contact you to then set up their first session. Amazing.
Usually I go and we have a chat at first, and I do a bit of a screening.
Yes.
So where I ask lots of questions just to get a really good idea about the mum and where she's at.
Yeah, and her history. And I think that's one thing that I have complete confidence in referring to Alicia. And I know I can speak from experience, unfortunately, in referring to other professionals, in that they're not actually asking possibly the right questions and getting a really, really good picture of this woman's history, because that so often can then determine where she's at, what she could do, what she shouldn't be doing.
Yeah.
So I have my complete confidence in actually sending my patients and clients to Alicia, because I know that those sorts of things will be screened for, and that they won't be missed, and so she won't, Alicia won't be giving them exercises that could actually be really, really detrimental.
Yeah, it's really important that women know and are aware that even just their birth story of what has happened to them during birth can have an impact on their pelvic floor. So I like to ask things like, did you have forceps or vacuum? Was it a super quick, explosive birth, or were you pushing for a really long time? Do you have a history of prolapse in your family? There's just lots of different things that can go on that can...
Well, this is it. And then I think, women a lot of the time after having their babies, like, well, I'm not leaking, I don't feel heavy, I'm having sex, I'm actually completely fine. My pelvic floor is fine.
Yeah.
So I can get back to running. I had my 6-week check. My doctor said that I'm all good. So I'm good to go and do, box jumps and burpees and running. So let's get started. And it's kind of like, we need to screen for certain things, because so often, and the way that I describe it is, yes, you can be kind of getting away with not having any particular symptoms or any real concerns, but there can actually be underlying issues and causes that if you have an assessment, if you have the right questions asked, you can actually have those issues highlighted, dealt with, and then get back through your exercise and rehab, and down the track you don't then have any concerns.
And do you know what? I was actually one of those women where after the birth of my my first baby, not my second, I got my 6-week GP checkup and thought that I was just gung-ho, right to go, went back to running straight away, doing all my heavy lifting in the gym, doing everything, and thought, I don't have any symptoms, I'm fine.
And because you were a fit bunny beforehand as well, and your body was used to doing that, so you would have had a level of fitness that probably a lot of mums who weren't that active pre-baby had, and you probably felt comfortable doing that. You had no symptoms, so you thought, well, what's the problem? I can do it all.
Yeah, 100%. And it wasn't until later, after my second baby, where I had a prolapse, that I realised that I already had one after my first, but I wasn't aware of what the symptoms were. I just thought, I didn't actually really know anything about prolapse, to be honest.
Which a lot of people don't, unless you have a family or your mum or a sister or a friend or yourself actually go through those sorts of symptoms. A lot of the time you have no idea of what it is, how to treat it, sort of how you go about managing and dealing with one. So that is what we're talking about today, is prolapse. It's the dreaded P word. I think a lot of people have just such a huge fear surrounding prolapse. They think, oh my gosh, literally my insides are falling out. I have to have surgery, I'm not going to be able to lift my baby, I'll never be able to have good sex again, I don't feel like a woman. A lot of people tell me that, in that I almost feel like, you know, I don't feel as feminine anymore, I don't feel connected to you know,
that sacred part of you is ruined.
And there's so many really, really mixed emotions, and I'll just say whatever emotion you're having about that is completely fine. But be reassured that there are so many conservative options that sometimes surgery absolutely is warranted to deal with your condition and your concerns, but there are so many conservative options that you can actually be putting into place before that a lot of the time actually improve your symptoms to the point where you're completely unaware that they exist. And even if you do end up going on and having surgery, the statistics actually suggest and show us that the rate of recurrence and the rate of ongoing issues long term are much less if you can actually have a really strong, well-functioning body, pelvic floor, etc. Firstly, I guess I want to talk about, how do you know if you have a prolapse? Like, what sort of symptoms do you think? What sort of symptoms are you screening your clients for? What would you be experiencing to think, I actually may have a prolapse?
So there's quite a few different things. You can literally feel like a bulge in your vagina, either on the outside or the inside, that you might notice. You could have urinary incontinence or bowel as well. Or it could go the other way, and you could be having trouble emptying. Which that was actually my problem after my first baby, but I had no idea that was a symptom. So they're big ones. Also a heaviness or a dragging. Lower back pain too.
Really common.
Can be a factor. What else would you...
They're the primary ones, and I think especially in this postnatal phase there are lots of things that actually contribute to that sensation of prolapse. It's very common to have a sensation of genital heaviness, especially after you've just had a baby. You know, everything's very swollen and sore and lax. But the thing is, the majority of your relaxin, so one of your primary softening hormones is called relaxin. Your relaxin levels are at their highest literally at the point you're birthing your baby or you're having a Caesar, okay? And then they just progressively drop off after that. Now, relaxin literally softens and makes everything really, really stretchy. So around the 50% of all of your relaxins out of your system at about that 12-week mark. So what I say, if you have symptoms of heaviness, dragging, you know, those bladder bowel sort of concerns, absolutely we need to be discussing it. But up until that 12-week mark, it can actually be kind of reasonable to be experiencing that, even though there are plenty of things that we can be doing to actually manage it. I'm not jumping up and down if people are actually feeling those sorts of sensations, because I'm very reassuring, saying, look, it can actually really turn a corner around that 12-week mark. The other thing to note is with breastfeeding, and I'm very pro-feeding, I'm fed is best, so whatever choice you go down is fantastic. But with breastfeeding, you can definitely have laxity for as long as you breastfeed for. And some women breastfeed for longer than that 12-week mark. They breastfeed for 6 months, 12 months, longer. So if you have sensations or symptoms of prolapse, all those beautiful softening breastfeeding hormones actually soften the vaginal walls and soften all the suspensory ligaments that hold your bladder, your uterus, your bowel up. So both relaxin and all those breastfeeding hormones actually make everything a lot stretchier. So without a doubt, those symptoms of heaviness, dragging, the pulling type, fullness sensations, not being able to use a tampon. So that's one of the biggest signs that post-baby women say, I just can't use a tampon. It almost feels as if my vagina's been shortened, or when I'm having sex, it feels like my husband's actually hitting something hard. So those sorts of sensations of my vagina's shortened, I can't actually use a tampon, I can't have sex comfortably. But from a bladder bowel perspective, as Alicia said, the incontinence, but the incomplete emptying, and a lot of the time that comes from the bladder and the bowel actually, bladder and bowel actually dropping into the vagina, so it creates this sort of pocketing type effect where urine and, you know, stools can actually stay, so it gives you that sensation of incomplete emptying, which is not pleasant at all. So never pleasant to experience that. So they tend to be really, really common symptoms of prolapse. So I guess if anyone's experiencing these sorts of symptoms, what would be something that you would be suggesting to start to do straight away? Like, what would you say if someone came to you and says, oh my gosh, I have these symptoms, what would you say? You need to go and do this straight up.
I'd be saying you need to book an appointment with your physio.
Yep.
That's key. I think it's good to go and see your GP, but physio, your women's health physio deals with this all the time and knows exactly what they're looking at. And then I would say if you can get your bum up on a couple of cushions a day and just laying back with your hips raised a few times a day, just spending a bit of time in that position.
Huge difference.
That's going to make a huge difference.
And normally we say in that position about 15-20 minutes if you can. With a brand new baby, I know that's hard.
So hard.
It's hard to do anything with a new baby, I know, but if you can get into that bum lifted or that, elevated position, you're just then utilising gravity to your advantage as opposed to everything just being pushed down.
And do you know what? Like, I found I tried to do that whenever my baby was sleeping, even though you've got a mountain of housework to do. You can't keep going if you don't look after yourself.
Yes.
And if you can make that time, I used to put a little bit of music, like some soft music on, and just focus on breathing and trying to just relax. I mean, you feel like you've got a million things to do, but it's so important to look after yourself.
And I think when you're constantly in that overdrive, that also, all those stress hormones won't help the situation either.
No.
So even though being a mum is particularly stressful, but add prolapse into the mix and feeling all the feelings that we were talking about before, it's just can be a very stressful time. So completely agree. I think that's a really, really lovely idea to almost make it a meditative relaxation experience.
I often, it's so funny, but the one thing that I'm grateful for my prolapse is that it taught me how to stop and meditate and look after myself.
And how many mums and women don't?
I know.
It's kind of like, no baby, everything else has to come first and I'm the last on the list.
I know. So if you can make that
silver
time.
lining. Yeah. So physio check or GP or obs gynae, get your bum up. And then I guess avoiding sort of the big things that without a doubt are going to make it worse are things like bearing down, straining, becoming constipated. So definitely getting on top of that, however you feel
100%.
works for you. Notoriously, it's not drinking enough water for a lot of women with constipation. So make sure you're drinking enough water. And again, that could be a whole conversation itself with how much water should I be drinking, but just be consulted by your fitness professional or your physio or your GP as to how much you should be drinking. So manage constipation, because that is without a doubt, if you're bearing and pushing down to empty your bowel, like unravels everything. So really, really important you get on top of constipation and straining. Heavy lifting would be the other thing.
Definitely avoid that.
And as a mum, you're constantly lifting.
You are.
So what's heavy? They say, like, I'm sure a lot of women are probably thinking, well, what's heavy? Like,
heavier than your baby.
Exactly.
If you can avoid lifting anything heavier than your baby. And then again, when you see the physio, they'll talk to you about safe ways to lift your baby as well. So, and I think, when we're constantly go, you just sort of get in there and get it done and don't think about what you're doing. But again, with a prolapse, so many of your symptoms can actually be reduced if you actually just stop for a second and just consider what you're doing. So true. Weight is definitely, so lifting something heavy is a really, really big thing. And the other thing is exercise, which is again why Alicia is just the best person to be talking to about this, because you're a fit pro, you're a fitness professional. What sort of exercise could you be doing that could make a prolapse worse? Or what exercise would you say to women if they did have a prolapse or were worried, I don't want you to be doing that? So if you've got a prolapse and you haven't yet been to a physio and gotten built your pelvic floor strength up, so you're working with weak pelvic floor and prolapse, you definitely want to be avoiding any plyometrics, so any bouncing motions, any heavy weight lifting, and also you don't want to be doing any crunching or planks or anything that's going to cause, they call it intra-abdominal pressure, so any downwards pressure that's going to be pushing onto your pelvic floor. Also, if you find that you're doing a form of exercise where you're having to hold your breath, you shouldn't be doing that either.
And that is a really, really great point, because that's one thing that's straight up with general ergonomics and how to move and how to live your life with a prolapse. That is kind of a non-negotiable for me. in that if you think about yourself as like a cylinder, I talk about a Coke can, and lots of people say, I don't drink Coke, so if you think about a can or a pressure cooker, if you like, I just think a Coke can's easy. We've got a hole at the top where our glottis is, where we're going to breathe in and out of, and then we have a hole at the bottom, which is our pelvic floor, our vaginas, everything. If I'm actually breathing in, I'm filling that cylinder up with pressure and air, okay, which already places pressure down onto my pelvic floor and my prolapse, and then I'm actually lifting or doing whatever, and that's not even necessarily just exercise, that's standing up from a chair, that's lifting up my baby. So that is such a good point to raise, breathing and making sure, and that's one thing that a lot of people are confused about, should I actually be breathing in or breathing out? And it's actually breathe out. With that movement, or breathe out when I'm lifting something up, because getting back to that Coke can example, if I breathe in and hold my breath, which is inherently what a lot of us do when we do lift something up, isn't it?
Yeah, 100%.
We stent and hold because it feels like that's a lot more stable, it holds everything together, but that increases, puts pressure into the cylinder already, then I'm lifting up that object, so it's just loading so much more up. So if I can actually breathe out, think about this cracking the lid of the Coke can, I'm letting some of that pressure go, so straight away that can really, really reduce your prolapse symptoms and that constant exacerbation and pressure that builds up throughout the day. The cumulative build-up of pressure is one of the biggest things that a lot of people say, I always feel worse in the afternoon, or I'm always more symptomatic in the afternoon. It's that heaviness. So breathing is super, super important. So with rehab, I guess, yes, I'm worried I have a prolapse, or yes, I do have a prolapse. What are my sort of options? Where should I be going to? We've spoken about physio is obviously a really, really great starting point. But what does rehab actually look like with a prolapse? I think a lot of people are petrified to come in and have that initial assessment and be told, yes, you do have a prolapse, because they're thinking, oh my God, my life's falling apart.
I know. It's all about just rebuilding yourself from the inside out. So
I love that idea.
Yeah, it's all about, we need to, obviously, we're going to be rehabbing and working on strengthening that pelvic floor. So making sure that you're doing your pelvic floor exercises properly, which is a big one, because so many, 50% of women aren't doing them right.
And so Googling the good old Kegel exercises. Yes, I guess it's kind of better than doing nothing, but sometimes you can actually be bearing down, which without a doubt make your prolapse worse. So, and it's not me just saying this to encourage you to come in to have an assessment, but you don't know what you're doing until someone actually assesses you.
It's so true. And I always say to my clients, like, I can't see what your pelvic floor is doing.
No.
It's impossible for me to check your pelvic floor. I can ask you and you can give me cues of what you think you're feeling, but physio is without a doubt, the eyes on the inside.
And this is it. I think it's sometimes people say that I can assess your pelvic floor by actually touching your tummy and assessing, and what they're actually touching is a lot of the time a muscle called the transverse abdominis, which is more or less like a corset muscle. You can actually palpate that muscle superficially just on the inside of your hip bones. And when you're activating properly, when you're activating your pelvic floor properly, that transversus actually switches on after the pelvic floor is switched on. But you can actually switch your TA on without switching your pelvic floor on. And unfortunately, if you're switching on your TA, and as some people say, just switch on your core, you actually create almost like a toothpaste tubing effect, in that I'm squeezing you in the middle and that actually pushes pressure down onto my pelvic floor. So that comment of having an assessment to actually know what you're doing and how to actually squeeze my pelvic floor in the first place is without a doubt the most critical step in rehabbing a prolapse.
100%.
So I go to a physio, I start with some pelvic floor exercises. What sort of other things, I guess, could you expect from a pelvic floor physio, and then where to from there?
So, well, I guess I always work really closely with the physio and we work together. So I'll check and make sure and see where you're at, where your pelvic floor is at. And that's what whatever fitness professional that you're working with, that's what they should be doing. Because everyone's different depending on how strong your pelvic floor is. And then you would want to be learning to do things like how you're going to, say you want to go for a walk, pushing your baby in a pram. So the physio is going to work with you around how to do that, and the fitness professional as well. How to be lifting things. How to just go through functional movements while activating your pelvic floor and lifting so you support it.
Beautiful. Fantastic. Really, really great. So I guess another thing with physio is that when you are seen by a good physio, an unbiased physio, if you believe that you're really giving these exercises a red hot go and you're just still feeling symptomatic, the conservative road isn't yet over for you. There are still lots of other options available. So things like pessaries. So pessary, they come in all different shapes and sizes depending on what type of prolapse you have, depending on your size internally. Now, pessaries can be fitted by lots of different people, but I only refer to physios who have a special interest in fitting pessaries, or your obstetrician and gynecologist. And that's not me saying that other professionals who fit pessaries don't do a good job, but I've just had very good experiences with those two professionals fitting pessaries, because they can be fitted wrong, and there can be two different things that go wrong. They can either be too small in that you pop them in. So a pessary, I'll just explain really what it is. It can be like a little, like a silicone sort of rubbery ring. They can have cubes, they can have all the different shapes, as I've said, where you can actually put it in yourself. And the whole thing with a pessary is it actually creates almost like this scaffolding that holds that wall, holds everything up and back. Now the beauty with pessaries is that when they're fitted properly, you actually can't feel them. They're comfortable to wear.
I can honestly vouch for that. I had a pessary for 2.5 years. And once it was fitted properly and it was in there, I didn't even know. It was. I had one. Some of them you take out, or some of them you can just leave in. I had one that you could just leave in. And that I felt so much more supported. And people say, all right, well, should I just use pessaries on their own? And I definitely suggest continuing a physio, because again, another visual, but think about sort of a bowling ball sitting on a trampoline. You're actually lifting the bowling ball off of the trampoline so the trampoline can actually continue to work. If the bowling ball's constantly sitting on the trampoline can actually become fatigued. Of course, the trampoline in this example is your pelvic floor. So it actually works beautifully doing both at the same time. So using that pessary to lift the weight up and off, and then strengthening your pelvic floor at the same time. And I'll just say that some women, even if you strengthen your pelvic floor and your pelvic floor is perfect and it's beautiful and strong, the pessary comes into play when it's actually a structural, weakness, in that in continuing to strengthen your pelvic floor, sometimes that actually doesn't improve. So having that structural support is really, really beautiful. And some women actually feel symptomatic only when they go for a run, or only at the end of the day, or only when they... So true.
So just putting the pessary in for that exercise, then they can take it out afterwards. So it's really important that you see someone who is a professional at fitting pessaries, so that they fit it correctly, so it's not too small and it doesn't just fall out, or it's not too big and then create friction. So it has to be fitted correctly. And one thing that I cannot stress enough is you have to be shown how to put it in and take it out.
Oh, definitely.
Like the nerves, I think, when clients come back and they're like, I don't want to touch it, I don't even want to take it out because I'm terrified I won't be able to get it in again. So whoever fits the pessary for you, make sure that you really ask them to insist, can you please show me, can I actually practice taking this out in front of you?
They're confident that you can take that pessary out and put that pessary back in again.
Definitely. So physio, strengthen your pelvic floor, get it really isolated and strong, and make sure that you functionally know how to use your pelvic floor. If you're still symptomatic, then absolutely pessaries can work beautifully. But other things like, estrogen therapy and those sorts of things, the progressions and the improvements with estrogen and hormone therapy are fantastic. So you can use creams, you can use little tablets. The estrogen actually makes everything a little bit thicker and plumper, so it can actually hold the vaginal walls a little bit better. But that is, you need to be speaking to either your obs-gynae or your GP about that. But that can work beautifully in just improving that sort of internal general stability. And then of course there's always surgery at the end of all of this. If you're finding that I'm still just not satisfied. And I just want to stress, you do not have to live with symptoms. If someone tells you, well, this is just your vagina, you're just going to have to live with it. It's just kind of normal for after having babies. That doesn't fly with me.
No,
feeling terrible about yourself and not feeling strong and confident and not being able to do the things that you really want to do, you should never be made to feel that way.
No.
So if you're still, after doing all this conservative therapy, still feeling, I just don't feel right, still I can't do what I want to do, absolutely get advice as to who to see for a surgical review. Because there are lots of different really great surgical options that don't include mesh, that don't include all the nasty stuff, that are very common, straightforward procedures that if you've done that rehab beforehand, you tend to bounce back and you tend to have really, really good results from. So, but it's certainly not, surgery is certainly not a quick fix. It's not something that I would recommend immediately everyone dive into.
You want to have really gone through your rehab before you get to that point, you know, because you never know. I've got women that I work with who have got prolapses, and when they first came to me, they were so symptomatic, and now, you know, they might get a bit symptomatic around their period. But a lot of the time they've got a pessarine and they're totally fine, and they're doing
what they want to do
so much more than what they were able to do at the beginning. You know, we're doing full exercise sessions and they're sweating and they're, you know,
feeling amazing.
They're feeling amazing and strong and so good. So that, you know, it doesn't happen to everyone that you need to get surgery. Sometimes you do need to get surgery. I had to get surgery. But in saying that, when I went in for my surgery, I had a bowel, uterine and bladder prolapse. But when I went in, through all the physio that I'd done, I didn't need to get the surgery on my bladder. It was just my bowel and my uterus. So that was through doing physio.
Yeah, and improving your strength and stability.
Exactly.
So, I can't stress that enough. And at the end of the day, you can die with a prolapse. Like, it doesn't actually matter if you have a prolapse and you're asymptomatic.
Exactly.
Even if you have that prolapse and you don't feel it, but you know on objective exam, every time you have a pap smear or every time you come and see your pelvic floor physio, they're like, look, it's still there.
Yeah.
It actually doesn't matter as long as it doesn't bother you and as long as it doesn't get in the way of your everyday functions.
I don't think that it's going to be a nail in the coffin of what you can do, because there's so much that you can. All the different women that come to me that I work with are at all different levels and stages of their pelvic floor or prolapse, and I work with them individually. No matter where they're at, there's a million exercises they can do. There's so much that they can still do.
And again, I harp on about this, but coming back to the first thing that I said about Alicia, that is without a doubt, if you are working with a fitness professional who hasn't asked you these questions and you are a postnate, you need to be having a chat to them about, you know, your birth history, and you need to be highlighting these sorts of things. That is not me saying who you're working with is not good. That is not me saying that at all.
They might just not know. You don't know what you don't know.
Well,
you know? And unfortunately, a lot of PTs haven't done a pre and postnatal course, or they haven't had the experience, and they just don't know that they're meant to be asking those questions.
So if you do have a prolapse, or you're worried that you do have a prolapse, and you have no idea where your pelvic floor is, or your pelvic floor is on the weaker side, what sort of exercise or what sort of things could you be doing from an exercise perspective that would be relatively safe, that you could assume that would be safe and wouldn't actually damage your pelvic floor or prolapse further?
So I would definitely be working with my clients, and I would say that it would be safe for you to be doing things like bridges, or hovers, so where you're on your hands and your feet and your knees are under your hips, and just slightly lifting your knees and engaging. So that's safe.
So sort of in like a 4-point position.
Even your 4-point push-up. So where your hands are under your shoulders, knees under hips, and you're bringing your nose down. That would be safe. Lunges, as long as you're not going too deep. Just don't let your hips go below. Your hips go below your knees. And same with squats, but making sure that you keep your legs not too wide.
That's sort of those sumo squats are wide, because it's just hard to hold everything in there.
It is very hard. You're in a very compromised position. And also just just not going too deep either. Like you want to keep your hips above your knees. Things like doing, you know, your donkey kicks. You can even do on your belly, like a leg curl on your belly with a dumbbell between your feet.
Fantastic.
Some TheraBandy stuff will be okay. Like, especially, but if you're going to do anything weighted, I'd definitely be sitting. If you don't know where your pelvic floor is at, and you've got a prolapse, or you've got a really weakened pelvic floor, I'd be sitting.
For sure. Just because that sitting obviously gives you just that extra support then. Without a doubt. One thing that I'm probably good to say here is post-exercise, I always say to people, make sure that you have part of like your stretch and cool down routines, make sure that you get your bum up into that position. Just sort of take the pressure that you have possibly put onto your pelvic floor during that session, take that pressure off.
And also some really deep belly breaths where you let everything go as well, because I think sometimes we can be so clenchy with our pelvic floor because we're so worried about the prolapse or the weakness there, so we're switching it on all the time.
Constantly.
So you've got to make sure between your exercises that you're just taking big deep breaths into your belly and then just letting everything go.
Perfect. So I guess then working with your physio to strengthen your pelvic floor and make sure that your physio is constantly in communication back and forth with your personal trainer. Definitely. I think that what works has worked beautifully with us working together in the past, and that you know, Alicia has these amazing tick and flick forms where she says all these different types of exercises and what's appropriate and what's not appropriate, and that changes as your pelvic floor progresses. You will be able to do more and more and more of those exercises, and you know, add more weight in and do more exercise, possibly to the point of even starting to run and jog and lift more weight and start to do more sort of plyometric type exercise. But without a doubt, it's just making sure that you are supporting everything at the start. You still can exercise with a prolapse, okay? You can still exercise with a prolapse. But you're just wanting to make sure that anything that has the potential of actually pushing down, you're really trying to minimise that as much as possible, especially if you have no idea where your pelvic floor is at and what you're doing. I think the point of today's chat was just to stress, if you are worried about this, even if you're not symptomatic, but just out of interest, you want to see where your pelvic floor is at, you're doing exercise with a PT, or you're doing CrossFit, or you're a triathlete, or you love running, or whatever you're doing for exercise, and you're just not sure where your pelvic floor is at.
And you could have had your baby 10 years ago. Like, it doesn't matter. So many people think, oh, I'm not in the postnatal. So I think you're always in postnatal. Once you've had kids, you're always...
You're always a postnatal. Exactly.
So if you've never been to a women's health physio...
it's really, really beneficial to know where you're at, because as we've discussed, you don't actually know if you're squeezing your pelvic, and you may have a beautiful, well-functioning pelvic floor, and the physio says, go ahead, you're actually great, go for it, but you may actually have a really, really low-grade prolapse you actually aren't aware of yet, that the physio may be able to say, look, you've actually got a really, really tiny prolapse, I just want you to nip this in the bud and get started with this straight away, and you then can live the rest of your life and you don't even know about it. So I really implore, get the check, see a professional who has had that extra postnatal training in terms of exercise, or see obviously your local women's health or pelvic floor physio to at least get a bit of a program together so that you can take that to your PT, because you may be in an area where none of your PTs have done extra training. So see your women's health or pelvic floor physio, get a list of, right, I should or I shouldn't do this, take that list to your PT and get your physio and PT to actually work really, really closely together. Because we work beautifully together. You know, we both have different levels of or areas of expertise, and we work beautifully together, I think, to be able to provide women with a really, really great platform to strengthen and get themselves back to doing whatever they want to. Well, that's enough, I think, from us, but we're giving you a big cuddle down the camera. If you have any questions or any hassles, or you want to check, or you're worried, both Alicia and I would just love to have a chat to you and make you feel at ease and reassured about where to go to from here. But please don't hesitate to reach out to us. Alicia is on Facebook and Instagram, so reach out to her.
100%. And I'm always willing to just come and have a chat. You don't have to book in for a session, even if you just want to, you know, you're interested in getting back into fitness and you just want to have a chat.
And where to from here.
Yeah, exactly.
That's fantastic.
Yeah.
All right, well, take care, everyone. We will see you soon. Bye.
Bye.